Good morning. This is Dr. Rutledge, and I'd like to talk to you a little bit about the Roux-en-Y gastric bypass, or the laparoscopic Roux-en-Y gastric bypass. Many surgeons who support that and favor it and perform the Roux-en-Y gastric bypass call it the gold standard. And that's a little bit amusing given that there are dozens of different types of weight loss surgery, in which at the meetings where surgeons discuss weight loss surgery, there are certainly a lot of proponents, especially in the United States, of the Roux-en-Y gastric bypass. There's also lots of surgeons who are doing other kinds of surgery, and lots of Roux-en-Y surgeons who are aggressively investigating different and new techniques, things like the sleeve gastrectomy that are designed to improve upon the weight loss surgery that's already available. So when one says the Roux-en-Y gastric bypass is the gold standard, you have to kind of take that with a little bit of a grain of salt. The Roux-en-Y gastric bypass involves cutting through the stomach and leaving a small stomach pouch high in the abdomen near the chest, and then going down to the lower part of the abdomen, cutting through a piece of intestine and bringing one end of the divided intestine up and hooking it to the small stomach pouch, and then hooking the remaining piece of small bowel to the side of the bowel that was brought up. And that's a very standard kind of surgery. It's been done for years, and it's a good choice, but the complexity of the surgery has some disadvantages. There are some pretty strong complications that can occur from it, and a few disappointing studies that lead us to prefer the mini-gastric bypass. Probably one of the most concerning studies has come from the state of California, where every Roux-en-Y gastric bypass patient was studied. In all of their cases, what they determined was that the chance of needing to be in the hospital doubled after you had the gastric bypass. So when they compared hospitalization for patients who had the Roux-en-Y gastric bypass, the year before surgery, it was half as often as the year after surgery. So we're hoping, of course, to help people with weight loss surgery, and it's really disappointing to see that the Roux-en-Y led not to lower frequency of hospitalization, but higher frequency. Now, it is true that the Roux-en-Y helps people by decreasing their diabetes and high blood pressure and things like that, and a lot of studies have shown that. The disadvantage is that surgery itself comes with a lot of attendant complications, leading to somewhere between 15 and 20% of patients being back in the hospital in the first, second, and third years after surgery. These complexities, complications, and bad outcomes are what lead us to prefer the mini-gastric bypass. Our recent studies show that hospitalization rate, instead of doubling, is cut about in half after the mini-gastric bypass, suggesting that the shorter, simpler, lower risk mini-gastric bypass has a lower risk of needing rehospitalization, and another advantage over the Roux-en-Y gastric bypass. For more information, don't hesitate to call me anytime, email me, or visit our website for more information. Thanks, and have a great day.